you're welcome. It's another episode on Time with the Gynae. This is Dr. KK. So, on the last episode, we spoke about the schedule for antenatal care. So, I explained to you the various times you're expected to see your midwife or your doctor who is taking care of you for your antenatal care services. So, today, I just want to run you briefly through how the whole service delivery goes like. So in your first trimester, which is the time you notice you are pregnant, to the 12th week or 13th week, that's about 3 months, the first 3 months. Pregnancy is 3 months, 3 months, 3 months. That's 9 months in total. So the first trimester, where I know a lot of you or a lot of people don't want to even go to the hospital because they don't know what people say that, oh, we don't know if our pregnancy will stand or it will continue into the other trimesters. But I encourage you that in the first trimester, at least one visit is important. But per the schedule, from the time you go for the antenatal visit, you're expected to come every month from the beginning. So at least if you start right from the beginning of a pregnancy, you will go for at least 2 visits in your first trimester. If you will not even go, please go for at least 1 visit in your first trimester. And I encourage you that you do it early. Immediately you realize you are pregnant. I'm sure if you've been following my videos, you understand that there may be some medications you have to be given. There may be some medications which have to be taken out of the drugs you are taking. So it's very important. A scan will have to be done to be sure where the pregnancy is located. So all these are very important reasons why you're expected to start your antenatal clinic very early in the first trimester. At least 1 visit is key. Now, from the second trimester, so in the first trimester, what will happen is that at least 1 scan will be done. 1 scan will be done to locate the pregnancy, to look for any other conditions or problems around your womb. So any pathologies that will be identified will be added to your history so that going forward, that is also managed or taken care of. In the second trimester, which is also very key, you are required to go monthly. So every month, every 4 weeks. This is the general schedule for low risk pregnancies. For high risk pregnancies, as I explained in the other videos, you may be expected to go a little more often. So take note, this is for low risk pregnancies. In your high risk pregnancies, you may be required by your midwife or your doctor to come more often for the antenatal visits. So monthly visits. Now for the second trimester too, the same medications you are on, you may be taking them. But I want you to understand that the symptoms, early symptoms of pregnancy, which I've also spoken about in one of my videos, gets better as the pregnancy is progressing. So for most people, we expect that around 16 weeks thereabout, most of the nausea, the vomiting, the early morning sicknesses may have subsided or may have aborted for you. There are some that may progress even all through the pregnancy. But for most people, by 16 weeks in the second trimester, most of these may have been aborted. Now, your midwife or your doctor may require that you do some scans in the second trimester. The most important scan you'll be expected to do in the second trimester is what we call the anomaly scan, or some of the people call it anatomical survey of the baby. So what this scan is doing is that it's checking the various parts of your body, the baby's body, to be sure that all the parts have formed well. That is the anatomical survey or the anomaly scan. The purpose of the scan is so that if any anomaly or any abnormal growth is identified, whatever abnormality is identified is assessed to be sure that that abnormality is compatible with life, or it's such that when the baby is born with that anomaly, the baby can survive normally as any other person. So that's the reason why the anatomical survey or the anomaly scan is done. It's the most important scan you will do in the second trimester. There are some peculiar cases like diabetes, hypertension in pregnancies where your midwife or your doctor may require that you do other investigations. Other people who have something like sickle cell, people with anemia, people with any medical condition in pregnancy, your doctors may require that we screen your urine more often, we screen your blood more often, just to look out for any issues that may be happening with you for the period. So these are peculiar cases where certain investigations may be done. But generally, in the second trimester, The scan is the most important thing. Your blood level will also be checked somewhere along the line in the second trimester. So take notes. These are required in the second trimester. There are some peculiar cases where, as you go, scans will be done monthly. So for people who have once had any abnormality in their baby's growth, any anomaly for which maybe the pregnancy was terminated or something, your doctor may require that even from the somewhere 20 weeks, that's about 5 months. Every month, the person may want to repeat the anomaly scan. But the truth is that by 20 weeks, almost the baby is fully formed. Every part of the baby is formed already. So the anatomical survey or anomaly scan is done between 18 weeks and 22 weeks. So your midwife or doctor may do it earlier, maybe 18 weeks, 19 weeks. Some may do it 21, 22 weeks. We don't want it going so far beyond 24 weeks, 25 weeks, or 28 weeks. By 28 weeks, the baby is viable per Ghana standard. So 28 weeks, 7 months, the baby is viable. So at that time, if there's any anomaly, it may be difficult terminating the pregnancy. You may have to deliver the baby. So it's very important. Second trimester scan is key. It's to check the baby's parts to be sure that every part of the baby is formed. So that's what I want you to get concerning the second trimester. I'll bring you what you are required to do in the third trimester. That is a little bit more intensive because you are getting closer to when you are going to deliver. So in the next episode, I'm going to talk to you about the things you are required to do, or that your midwife or your doctor will require you to do in the third trimester. Once again, this is Dr. KK. It's time with a gynae. If this is your first time on this channel, I encourage you to subscribe, like my video, share for others to also join and learn together.